So when we do an endometriosis ultrasound scan and we find rectal endometriosis, it's really important to not only look at the lesion that we can see, but also look above that. And so patients can potentially have what we call multifocal disease. So this is where there's more than one lesion in the same segment of bowel. So this is an example here where a patient who presented for an ultrasound scan that had symptoms, particularly rectal symptoms, and we noted that she had a lesion of endometriosis. This is this shadow here within the lower rectum. And then as we followed the rectal muscle upwards, we can see quite clearly here, here's a second lesion here now sitting in the rectosigmoid. So the presence of a rectal lesion means that it's so important to go looking superior to this, above this, to see if there's a second lesion, because in a patient that's got multifocal disease, so one segment of the bowel has more than one lesion in it, these patients that undergo surgery, we plan for these patients to have a segmental resection. So this is important when it comes to explaining to the patient what's going on. It's important when it comes to consenting the patient, and it's important that we get our colorectal team involved ahead of time so that we can get the best possible outcomes for patients that have multifocal rectal disease.